I'm Chandra Wilson. I'm updating my vids on post-op cystectomy, so getting the bladder taken out. What are the things you need to know? So these are commonly asked questions. I've done about 800 of these, and I've put together this list based on those questions as to what are common questions. So the first one is what's normal, what to expect. So we expect some bloating, we expect some back pain, there's stents inside, we expect even some blood in the urine on and off. With the stents, which are scaffolds or tubes inside, we expect to see blood in the urine kind of on and off until everything is out. We also expect to see mucus in the urine. Neobladders make mucus. They're made out of intestine. That's what intestine does, is make mucus. There's usually more right after surgery, and it gets less with time, but mucus, blood, some back pain, some bloating, all those are very normal. A low-grade fever is normal, and a little bit of wound irritation. If there's a little bit of drainage, less than an ounce, a little bit of bleeding where it just would be enough to spot a Band-Aid or a dressing, those are all normal. What's abnormal? What do we not expect? So things that should generate a phone call to our clinic or even a trip to the clinic or trip to the emergency room would be unilateral, so just on one side, leg swelling. That can be associated with shortness of breath, where you just can't even finish a sentence. And if that's the case, then it could be a sign of a blood clot. So that would warrant a trip to the emergency room. If the clinic's not open, there would be a scan done, and patients who have blood clots are started on anticoagulation so that a clot that's potentially in the lungs doesn't get bigger. Other things that are emergent conditions would be a temperature that's greater than 101.5. So a low-grade fever is pretty normal. If it starts getting up to 102 or higher, this can be a sign of sepsis, where it's getting into the bloodstream. Patients can end up in the ICU, so high-grade fevers are things we definitely worry about. Chest pain can happen at any time during life, but can be a sign that the heart is under strain. So we do recommend that patients with heart racing or heart strain come see us or get themselves to the emergency room so that they can get fluid and get their heart checked out. And then finally, two more. Not uncommon to get some bloating, some constipation, some difficulty getting the bowels to work normally. But if you just can't keep anything down and you're persistently vomiting, unless we get ahead of it with some IV fluids, then that condition will keep getting worse and worse, and patients will lose too much weight. So persistent vomiting. And then the last one to come to the emergency room or give us a call is if a tube falls out. Those tubes are in there for a reason, and they really do need to be in there for scaffolding. So let us know if that should happen. How do we get you to the other side? So we know that if we can get your bladder taken out, there is nothing better we can do to cure you. But we know that 3-month period in between is not fun. So what are things you can do to help yourself get to the other side? One is irrigate that catheter. If you have a neobladder and you don't irrigate, the mucus that's in there will back up the catheter. It will create openings where we have done all those sutures, and it will make everything take so much longer to heal. So please do irrigate the catheter. Also, you will probably be sent home on antibiotics. Take the antibiotics so you don't end up in the emergency room with a bad infection. We do recommend that you take probiotics with any antibiotics so that you don't end up with diarrhea caused by something called Clostridium difficile. How do we get you to be able to gain weight? A lot of patients lose about 10 pounds with this surgery. So getting back to normal takes time and patience, but also eating small meals frequently. Big meals don't tend to go through as fast. There's a pacemaker in the bowel, and we've interrupted that to make this new bladder. So small meals frequently help, and then meals that have liquids. Liquids go through so much easier. So at any time during the day, supplementing with liquids with calories, particularly proteins, really does help everything heal and helps patients kind of get over this surgery a little bit better. We do want you getting up, even though you've got to kind of force yourself to kind of work through this pain. We recommend avoiding narcotics if you can, using Tylenol, ibuprofen, Ultram, alternatives to narcotics, since constipation is such a problem. But working through kind of that pain, the bowel stuff that goes on. So getting up at least a couple times a day, at least like an hour or two of trying to get to the mailbox, and then maybe partially, down around the block, and increasing your activity over a month to 6 weeks as you're recovering. Most patients say it takes about 3 months to really feel close to back to normal as to when you started. And then the last thing is give yourself some grace. Taking naps, all of my patients say it helps during those first 6 weeks to 3 months as they're recovering. Finally, the tricks of the trade include testosterone replacement. So patients who are male patients often have kind of a reactive hypogonadism where their testosterone goes down low, where they have low T. So this can be checked. Even in the third of patients that do have prostate cancer with their bladder cancer, as long as we're doing it safely and following PSA and labs, the testosterone can be repleted. And this is kind of a trick of a trade to kind of help patients feel better faster. Antidepressants can be used because it is a lot to go through kind of these 4 surgeries in one, where we're taking bladder, possibly the prostate, the lymph nodes, and also a piece of intestine to build a diversion. So getting through this is major. So antidepressants, dealing with this new diagnosis, getting through the surgery can be helpful. And most of the time, after about 3 months, patients don't need them at all. And then finally, those protein shakes, as I mentioned, they really can help supply those extra calories to get everything to heal so that all the hardware can come out and you can go on to thrive.